Good afternoon, good morning, good evening, wherever it is the time of day in your part of the world. Thanks very much for joining today's webinar, hosted by BCN Group on scaling enterprise SPC, Statistical Process Control. It's great to have you with us. Thanks very much for taking the time to join us in your busy day. I'm Amar. I'm a physician by background and lead across England's NHS on the application of continuous improvement as the National Clinical Director in the NHS in England. It's a real pleasure to host today's webinar with BCN Group. And I'm joined by Robert and Oliver, and I wonder whether, Robert, you might introduce yourself first.
About that. Yes, hi, this is Robert Brooks, and I am the Director of Clinical and Quality Analytics over here at Henry Ford Health System in Detroit, and just have the wonderful opportunity of leading a group of analysts more on the acute care side, and sometimes we get into equitable care, whether it's by race, ethnicity, age, gender, and so forth, but it's to improve the quality that we give to our patients. Thank you.
Thanks, Robert. Great to have you with us. And Oliver, hi.
Yeah, afternoon, everyone, or morning. I think I've met a lot of you on the call today. My name's Oliver. I'm the EasySPC product lead here at BCN. So I've been supporting lots of organizations around the world with adopting control charts in Power BI. So good to meet you all today.
Super, thanks, Oliver. And we're looking forward to a lively discussion over the course of the next 40 odd minutes. We are recording the session today, and we're happy to share the recording with you. So if you have colleagues that want to listen back to it, feel free to share it with them afterwards. We'll also share the slides together with that, so feel free to sort of hold on to that rather than take pictures or things of what we're talking through. We really do want to encourage some discussion and interaction after you've heard from the three of us, so there'll be plenty of time. Put some thoughts in the chat as we go, or hold on to your question and you'll have the chance to put it to us at the end. So thanks very much for joining today. In terms of the plan for today, what we're going to do is just ground ourselves in what actually is statistical process control. Then we're going to learn from Robert and Henry Ford Health's journey in introducing statistical process control. I'll share a little bit about my own experience in an organisation in England called East London Foundation Trust, where we've been applying and using statistical process control for a number of years now, and how we've attempted to scale it and use it across the whole enterprise. Oliver will show us the EasySPC tool and what it can do, because I think it has some wonderful functionality that enables organizations to adopt and scale SPC. And then we'll open up for some conversation and discussion. So hopefully that will spark some questions and some ideas in your mind to have a good discussion towards the end of the session. But let's just start by just looking a little bit at what statistical process control is. And it's sort of, I want to ground us in where it began, because Walter Shewhart was the first pioneer really who started to apply statistical thinking in manufacturing and first started drawing Shewhart charts, what are now called Shewhart charts or control charts, statistical process control charts, to help understand the process of production in the telecoms industry, and to understand when something went out of control or whether something was in control, and to use a little bit more statistical thinking to guide decision making. These days, when we look at a Shewhart chart or a control chart or an SPC chart, this is what you see. It's basically the data presented over time as it occurs in time on whatever variable you're measuring. And what you'll see is it looks very similar to the kind of line graph we might have learned about when we were at school and plotting data over time, but it has some extra elements. It's got a center line, which is the mean. It's got some limits, which are the dotted lines, which help us understand, if the process is stable and in control, what are the extent to which we should be seeing variation. And using these kinds of charts helps us differentiate between when something is stable and predictable, otherwise known as common cause variation, and when something is unusual, what we term special cause variation. And that's really important, because being able to understand and differentiate these two helps make better decisions about what we do based on the data. And there are some rules that help us determine, when we're seeing special cause variation. And this is what we really want to talk about today. How do we start introducing this way of thinking and using data to make these more informed decisions on a better understanding of variation? Oliver.
So just as we move on to Robert's session there as well on Henry Ford's journey, there's just going to be a quick poll which comes into the chat just in regards to what SPC tools you're currently using in your organisations. So if you could all quickly help us and answer those questions, that'd be great. Thank you. Over to Robert.
Thank you. So let me get started with first thanking BCN for giving me this opportunity to share our journey with you. Because what really has happened, it's given me a chance to reflect and really don't have or do it enough. But that reflection has helped me see more clearly how far we've come and what it takes to achieve the goal that we're interested in. So this is not a finished success story, but it is a work in progress. So before I get started on the journey, let me give you a little context about Henry Ford Health. About 18 months ago, we went into a joint venture where our health system expanded significantly. And these numbers are a reflection of that. But I will say at this scale, it's become clear of the need for enterprise analytics. And that allows us to manage our performance. It creates consistency, it supports decision making, and it helps leaders learn across the system and not in silos. So, what is the why that we're doing with SPC charts? Next slide, please. And so, with any journey, you need to know the why. So, first off, it identifies meaningful change. SPC helps separate the signal from the noise. Secondly, it creates a common language. SPC gives teams a shared way of interpreting performance. And then thirdly, it moves us from having our data be passive to being active. SBC transforms data into action. It tells you when something requires a response. So in short, it helps us answer that most important question: should we act? So with any why, now there's a vision. We want to go from dashboards to decision systems, and we're going to use EasySPC. So I will quickly do a comparison between these two worlds. Dashboards and scorecards are descriptive by nature. Dashboards provide multiple varieties of viewing the data. Not all dashboards provide a clear trigger for action. As far as ownership, sometimes it's clear, sometimes due to longevity, we lose sight of who the owner is. And if I transition over to the decision system world, we start with the control chart. And as Amar mentioned, this technology started over 100 years ago, but it's set up for decision making. So we ask the question, is it signal or is it noise? If it's signal, we investigate immediately. If it's noise or common cause, and we're not meeting our target, we improve the process. This world is intended to assign ownership and action. The key difference between the two is not the data, but the decision process. The decision system world is really designed to consistently lead to action, accountability, and improvement. So with any um, vision, there needs to be a plan. Next slide, please. And so develop the plan. All right. And I will say that I consider two aspects, that being technical and cultural. And one would have thought that I started in the prepare box. But I will say that my impatience took over because EasySPC gave me this shiny new tool. So I started off by, bringing in experts and actually training the analytics community, creating sessions around SPC, the tool itself, and charts and so forth. And then I started jumping into opportunities. And when I say this, I'm in meetings and I'm hearing about these interventions that are put in play. And I'm saying, well, how are you going to measure if they are making a difference? And so we built charts, but I will say it didn't stick. So during my reflection, I always come back to this quote: the best laid plans of mice and men oft go awry. Next slide, please. So with that, I worked on the obstacles that were in my way besides just my impatience. Okay. So I'm going to start in the upper right. I call it the Big Bang. So when we expanded, almost double our size, one thing that came along with that expansion was an increase of our EHRs. And we went from 1 to 4. And you can only imagine the difficulty of communicating analytically and clinically. So we did a transformation on a conversion on our ambulatory side, but this past weekend, We did 7 out of our 8 hospitals, and we went down to 1 EHR, which we use Epic. But you can only imagine the attention that such a conversion consumes. We go counterclockwise, and I talk about organizational culture. I'm an engineer by trade, but one thing I've learned about culture, it's that visible inertia. We have developed a dashboard-driven culture, and it's how our leaders think and communicate. So SPC is not a tool, but it's a mindset shift. And so we have to get this mindset shift integrated into our culture. And then lastly, the number of initiatives has just grown and grown and grown. So if you think about that expansion, there's one thing leaders wanted to see is, integrated data, but they come from different systems. So that was a challenge in itself. And as technology continues to um, grow or change over time, one is artificial intelligence, AI. In order to take advantage of AI, you need a good data infrastructure. And one couple of pieces are important to that. That's data governance and semantic models. So those are all important in competing initiatives. And that's where SPC can struggle to gain traction. So how do I get through these obstacles? All right, so this is where my reflection has led me. Start simple. I started with these new KPIs. Our virtual ICU wanted to share or prove how they're helping out nursing. So those are new KPIs. We had a new review process for mortality. Don't start there. Start with the well-established metrics, like maybe sepsis mortality or readmissions, infections. And one of the key components or improving infections is hand hygiene. Start there. Then put your efforts towards the interpretation, because with control charts, it's the interpretation leads to action. One of 4 actions. One, if it's a special cause, you investigate. If it's a common cause and doesn't meet the target that you're seeking to achieve, you improve the process. So when you put that intervention in place, you can use the control charts to monitor if that intervention is driving the KPI in the direction that you want. And lastly, do nothing. And that is truly an action. I say do nothing because you may have set up a process that is performing like it should, and you want to sustain the gains, but you don't need to act upon it because your control chart is telling you that. So how do we get leaders to understand this? We need a better way of training leaders. Their time is really valuable. It's hard to, get all the leaders in a room and train them on SPC. So we need new approaches. And one approach that we're thinking of is to utilize 2 to 3 minute video vignettes. And I believe in the power of storytelling. And that's a way we can get the message to them in order to change that culture. And then lastly is the workflow diagrams. I believe this is truly key to get us to go from thinking about outcomes and thinking more processes. So we need to pair our KPIs with these high-level workflow diagrams. And this will help leaders understand what needs to happen in the process to improve the outcome. So let me close. And one of my favorite quotes is, when the process is right, the results take care of themselves. And I've always, for such a long time, attributed this quote to the man on the right, who is Taiichi Ohno, and he is the father of the Toyota production system. But recently this year, I discovered it's the man on the right, and that is Bill Walsh. He is an American football coach, and he's coached for 10 years, and he's won 3 championships. In baseball, 30% would be great. So, but one thing I can say, these 2 men come from different industries, but they live by the same motto, is focusing on mastering the process and not chasing the outcome. That's the journey that Henry Ford Health is on, moving from dashboards to decision systems. So I thank you again for letting me share with you that opportunity. And I'll turn it over to Amar.
Fabulous. Thank you so much, Robert. We're going to build on the story that Robert's just shared and the work that you're doing to introduce and adopt statistical process control. And I'm going to say a little bit about the journey of another organization in a different part of the world, East London Foundation Trust, where I've worked for 15 years. And the journey around statistical process control has not been in isolation. It's been one that we have really learned about through focusing on quality. And the journey really began with a number of serious safety events and using the learning from those to think about how do we improve quality better. And actually, statistical process control is a part of a much bigger approach to really systematically supporting our staff and our patients to be able to grapple with complex quality issues and use the method of quality improvement to improve care. Part of that is about learning and using data differently. And when we began this work, 15 years ago, people had to go to lots of different places to see their data. Data was presented really differently. You can see just here, some examples of the myriad of ways in which data was being presented, which made it really hard for people to make decisions. Because if your data is in lots of different places, it's presented in lots of different ways, it's hard to make sense of and to know what to pay attention to and how to make better decisions. When we were thinking about how to adopt statistical process control in a way that allowed our teams to be able to see their data in a fairly standard way, and bringing all the data that they need together in one place, what we realized quite quickly was that to be able to do that, we needed to bring all of our various data sources together into a single place. A lot of them sat in silos, owned by different parts of the organization. Some of them were on-premise, some of them were in the cloud, some of them were owned by our suppliers. What we needed to do was bring it all in-house and in a single place. Now that sounds simple, it's actually quite hard. It takes a while to do technically, but we needed to also wrap all this data around a team. And again, that might sound simple, but what you might find is that what's described as a team in one system is described completely differently in another system. So actually matching these things and it ensures that when a team wants to understand how it's performing, how it's doing, it can see its safety data alongside its workforce data, alongside its quality outcomes, alongside its finance data. And to be able to do that takes quite a lot of work at the back end to get all of the data sources in a single place, integrated, and ideally in the cloud now, because it's much more secure and more accessible. So that was one of the first steps to take. The next step we took was to think about how would we design analytics in a way that allows the organization to utilize data in a standard way, but allows the customization of what measures people look at so that they're really relevant for them. And these were the principles we developed in thinking about how we design. So one of those was really about working from team level up, starting with teams, understanding what are the decisions they need to make, what kind of data would help them make just those decisions, and then working with them to develop the set of measures that need to form their dashboard. The second was really bringing multiple sources of data together so that people don't have to go to different places, and really making sure that people can access this analytics from wherever they are at any time. And that meant, really trying to make sure that they were mobile friendly, could be accessed on or off premises from any device, and having improvement method embedded in this so that we were presenting data to them in a way that was consistent with the way that we were teaching people how to improve care. And that is through the use of tools like statistical process control, which allows people to make sense of the variation and then take action through an understanding of the variation. And that's led us now to developing a whole range of apps, all for clinical services. Each clinical service has its own app, which has been co-designed with them, and allows you very quickly to get to the data you need for your own service. Each of those apps has within it a whole set of dashboards organized around a very standard structure based on the sort of domains of our strategy. Oliver, if you want to go to the next slide, every dashboard, every set of analytics looks the same in that it's all wrapped around population health, quality, people, and value, which are the 4 parts of our strategy. And when you click in, you'll see your data presented as statistical process control charts. And obviously all of this is designed to be mobile first, so that everything is designed with mobile in mind so that people can access this wherever they are on the go. A lot of our staff would be outside of our hospital environments, in the community, in people's homes or on the move. And we wanted to make sure people can see the data wherever they need. One last thing I'll just mention before I hand over to Oliver is just how we started using this data as statistical process control, but presenting it in a slightly more intelligent way so that people can make better decisions within their huddles in operational flow. So this is an example of an early warning system, which we worked with our clinical teams and our patients to sort of understand from their perspective what might the 10 indicators be that they thought would be most important in helping them predict when a safety event was likely to happen on a ward. And then when we developed those 10, we then went back historically and looked at some safety events to test the validity of those 10 items. Did special calls on those 10 items help predict? Would it have helped us predict when those serious safety events occurred on those wards? And once we had that level of belief that these were the right 10 indicators, we then developed this early warning system with BCN, where actually underneath each of these dots is an SPC chart. But you're not confronted with 10 SPC charts. What you're confronted with, if you're looking at a unit, is just a very simple image like this, which drops into your inbox just before your weekly huddle, so that you can start to see, if you're Connolly ward, you can see, oh, look, there are 2 orange indicators there. Those orange things suggest that this week there are signals of special calls on those 2 indicators. And you can see very quickly how many of those indicators is demonstrating something of note that I might need to pay attention to. And do I need to then do something proactively to prevent an incident occurring on my ward? So that's just one of the ways in which we're starting to use this in a way that brings multiple sources of data together in a simple format to help people make better decisions at the point of care. Oliver, over to you.
Excellent. Thank you for that, Amar and Robert. Just as I stop sharing my screen briefly, as I'm going to do a live demo now, and bring Power BI up, there is another poll being put into the chat, hopefully for you right now, just asking what your organization's core reporting tool is. Go ahead and answer that. In the meantime, that'd be great. And hopefully you can all see my screen again now. See, I think just a quick thing, I think 90% of you said this so far said you're using Power BI. It's great. So those, the other 10% who are not using Power BI, this right here is an example of Power BI, which I'm showing you today. Power BI in the service, so it's in the cloud. I'm viewing this as an end user. What I'm sharing with you today is an example of a Power BI dashboard with healthcare data. What we're not saying is this is exactly how you should be as an organization using a Power BI, your data, creating your dashboards and SPC charts. It is just an example of. So what we can see here is that for our fictitious hospital we've created, Anytime Hospital, we've got a number of different high-level directorates that we can drill down into if we'd like to. And we've also got a leadership view. So I'm just going to quickly drill down into this leadership view where we've got some really basic heat map visualization for the organization and some key KPIs which some of the leadership team may be interested in. Really quickly, we can identify and see that, you know, there's a lot of red in medicine as an example. So what we can then do is we can drill down into medicine. And from there, we've got that leadership view of, okay, something's happening in the hospital. Okay, there's a lot of red in medicine. Let's investigate and understand what's happening within the medicine part of the organization. And now what we can see here is what we call a vector of measures for medicine, split off into the 4 key domains. So we've got finance, experience, quality, and performance. And it's the 6 key KPIs for each of those domains as well. And what we can then start to do, we can start to understand, okay, where are the potential bottlenecks, where are the potential areas that we need to investigate and see if there are any improvement needed and things like that. So, for example, we might see pressure ulcers and quality as flagged red to us here. Let's drill down into pressure ulcers. And now what we can see is we can see an SPC chart for pressure ulcers in medicine and how we're performing every week on an SPC chart. We can see where special cause is spotted. If you hover over any of the tooltips, you can see the special cause, which has been highlighted there for each one of those as well. You do have the ability to recalculate your limits and add annotations, which we may get on in a future webinar, or if you'd like to get into contact with us separately. You will have other filters, I'm sure. We've got weekly and monthly data in this. You may have daily data available to you as well. And again, it's just using the out-of-the-box functionality in Power BI to help end users navigate these different areas of the organization. And then we've got what we call Spotlight, which is a scorecard view of your data. And we're using Spotlight in this instance to drill down that next level within medicine. So now we're seeing the 4 units within medicine and how they're performing with their pressure ulcers. So we can see how cardiology, elderly, gastro, respiratory, for example, are performing. We can see which ones are showing special cause and therefore which ones we may want to drill down into those specific charts and understand what's happening in these particular areas. And we can navigate from there. We may then have other navigation options. As an example, we might have the different units in the top right, and we can hover, click into the gastro unit, for example, and we can see all the KPIs related to the gastro unit. And we can quickly identify where the special cause is, where it isn't, and where it is right now. So again, cost of agency spend. So that's flagged up again, as well as pressure ulcers. So is there a correlation between the amount of agency staff that we're bringing into the organisation and the quality of the work regarding pressure ulcers there as well? So yeah, that's sort of, I guess, the end of that quick demonstration for you there. Hopefully it's helpful just to give you a quicker overview and example of the types of reports and dashboards that you are able to create using tools like Power BI, just like Amar was describing with East London, have been on that journey for a number of years now. And of course, Robert and the team at Henry Ford are in that journey now too, as well. So we're now in the Q&A session. So I've not had a chance to look at the chat yet, but hopefully there are some questions in the chat. I did see some hands go up earlier on in the call as well, following Robert's session. So feel free to either raise your hand if you've got a question and you'd like to unmute yourself, or we can unmute you for you and you can ask your question and we can have a discussion. Or if you'd like to enter the question in the chat, then that is absolutely fine too. Whilst we wait for any additional questions then, I guess I'll kick it off. So Amar, if you don't mind me starting with yourself, could you help us share a little bit more about what enabled East London to scale SPC across the organisation over time? Were there any particular challenges or anything like that that you were able to share with the team today?
So I think it's really important to sort of think about the why. Like, why would somebody want to change the way that they look at data and use data? And for us, what was super important was that we did not try to scale SPC. We didn't try to help people adopt SPC in a vacuum. What we did do was say that as an organization, we were going to have a renewed focus on quality and introduce a way of tackling quality issues that really put the power in the hands of our staff and our patients. And that quality improvement method includes a range of different skills that people needed to learn, like systems thinking, like running tests of change, and understanding data and variation in data was one of those things. So it just became natural then for people to have more curiosity about data as they started to learn how to improve something. And so this was really about helping teams improve something that they really cared about. And that's, I think, a much easier way in than trying to push this as a technical product or a tool. If people are focused on improving something that they really care about as a team, and this is one of many things that they will find helpful then, or they see the need for, and they're much more likely to use them. I think the other thing to consider on is just how you can model this as leaders. So, as leaders, when we look at data or we ask for data, if our leaders start to realize that they're perhaps not making the best possible decisions, if they're looking at dashboards that are now recognized as pretty bad practice, red, amber, green, color coded, or just looking at data that's static point in time, they're probably not making the best decisions. Once you help people see that there's an alternative way which enables them to make better decisions, which is what we're all come to work to do as leaders and managers, then they start to ask their teams to look at data and present data differently. And that modeling from the top is super important. So we actually changed all of our board reporting, our executive suite reporting. And when people started to see that, they realized, well, this isn't just something you're asking me to do at the point of care. Actually, we're all doing it together. And it's influencing the culture of the organization.
Thank you for that, Mal. Excellent. I was going to ask a follow-up, but I see Marilyn has a question there. Marilyn, would you like to come off mute and ask your question?
Sure. Hi, I'm Marilyn from Network Performance Group. My question is, what kind of statistical expertise do you need in order to choose the right control charts for the right data sets and size and circumstances and all of that? Could you talk a little bit about that process? And that question is directed to anyone who can answer.
Thanks, Marilyn. Robert, do you want to start with that, and I'll give some thoughts as well.
That's a very good question. And so our strategy that we're trying to implement is to minimize the need for statistics. And here's why I'm saying that. We're trying to standardize the type of chart. And the type of chart we want to use is XMR. And the assumption for that chart to work is you have a normal distribution. So when you think about that, a lot of times like your time data and things like that are not in a normal distribution. And you work with our analytics team to get it put in a normal distribution so you can take advantage of that. And so, but for the most part, if you're going to use different charts, you're going to have an understanding of the data in itself. And there's a decision tree that you can utilize to say which type of chart to use. But like I said, if I step back and go back to why we're trying to create the same chart, we want people to see the same thing. So if you go from a XMR chart to a P chart, sometimes they get caught off guard why the control limits are changing. And we want to take that out of the interpretation and just make it all the same. But I think that decision tree will be very helpful and minimize the need for statistics. And I'll let Amar chime in.
Thanks, Robert. And Marilyn, you've got to remember my perspective is now, 12 years into an organization's continuous improvement journey. And we use a range of control charts. Robert's talking about sort of the value of just using one to start with. We actually recognize that there are probably 7 or 8 or 9 like control charts that we think we want to be using routinely. And actually, as we teach people how to improve care, these are clinicians, managers, administrators, we actually do introduce them to control charts and the range of control charts. We don't expect them to make those decisions themselves. We have an analytics team, we have an improvement team that has more expertise in that. And you're right, at the beginning, we did have to help our analytics team, our BI team, learn this. And it took a while, and it was important for them to understand what statistical process control is, the different kinds of charts, when to choose them. And they had people who were more skilled than them that they could go and ask questions to. So, when I showed you all of the suite of analytics and apps, there's a design process, and part of the design process is a technical one to help make sure we're choosing the right chart. And I would always look through them before they're released, and I would make sure that I think they're the right chart. So people have the chance to choose and use the decision tree Robert talked about. But then they also get the benefit of other people's view on it in case they're not sure. So you're right, there are different charts, and you do need to build some technical skill, but not everybody needs that skill. I think you need a core group of people to be able to choose the right chart and help others.
And just to add to that as well, I think Charles has made the comment in the chat too. Within EasySPC, if you are using EasySPC and Power BI, there is a chart selection wizard which will help you through that process as well, and it will essentially ask you questions about your data and recommend the suitable charts based on your answers there as well. And it's essentially using that decision tree, which Robert was alluding to there as well. Joe, you've got your hand up for a question.
Yeah, thanks very much. Joe Wickens from Midlands Partnership, NHS Trust. We're mental health and community, physical health and mental health trust, so quite large, maybe similar to yours, Amar, in what we offer. One of the things that I was just interested in, you mentioned how you started with team level, sort of with this work, but we're a team, we've got over 850 teams and thousands of staff. I just wondered whether or not both Amar and others, sort of on that journey of implementing it and shifting how people are using data and moving to those types of charts and bring data together, how do you move from like more local teams to it being organisationally spread from local teams through to board, so you got that coherent organisational approach? Because I know that, as you said, that's taken you 13 years. But how do you start? Where was that team start, and how did you snowball that in some way?
Hi, Joe. Thanks for the question. So it hasn't taken 13 years to do all of this work. The 13 years is really the overall continuous improvement journey. I think our work on SPC charts and bringing them into Power BI has really only been 7 or 8 years in duration. And some of that was the sort of initial work of trying to get the back-end data in the right place. So actually, the design process and building all of these apps has taken far less time. When I say teams, what I really mean is like start with the microsystem. And, we have 57 inpatient wards. We don't make 57 apps, right? We think, what does an inpatient team need? And we'll bring together a cross section of staff from our inpatient units. Maybe we've got one app for adult mental health as an example. All of our adult mental health apps look at the same data. We designed one app for adult mental health inpatients. Right. And that reaches maybe 35 of our wards, or in one app. We might have another app for community mental health teams. And that, again, we may have, 30 community mental health teams, but we'll bring a cross-section of staff together so that we're co-designing with them a single standard view for all community mental health teams, but it's designed at team level, so that you can pick your team and you can see your own data. So each app is a service type, and we've ended up with about 30 odd different service types. But there's no getting away from the fact that you probably have to start somewhere and go from there, and maybe start with where there's the most energy and excitement and willingness to use these. But we started at the top as well. So I didn't just start at the team level. We also started by changing the board pack, changing the executive team dashboard so that we're working at both ends of the system.
And very quickly on that, in terms of those key stakeholders for that shift, so I work within our continuous quality improvement team. We've got very good links into digital, OD, and so many different bits. But were there any really key sort of stakeholders that really supported that traction movement? Because it's more than one team, isn't it, getting on that sort of journey?
Yeah, I mean, Robert, you might have a good view on this because you're kind of closer to the point where Joe's at now. Who would you say are like the key stakeholders, Robert, from your system? You need to make sure you're taking with you on this journey.
Yeah, and it's what you mentioned, Amar. It's really starting at the top. You need that executive sponsor to, at least I feel, to really push it through. And that's one of the key things that I need to go back and do is get that executive sponsor. If you, like Amar said, if it's at the executive level, they're using it that way, they're thinking that way, though it starts to drive it through the system. You can start at the bottom, but once again, that inertia, I think, will overwhelm you. You can challenge that inertia better at the top.
Yeah, thanks, Robert. That's really helpful. And thanks, Amar.
Okay, are there any other questions from anyone? Anyone holding anything back? We might end a few minutes early otherwise. Well, I'll give you another 30 seconds or so. Well, thank you everyone for joining today. As we mentioned at the beginning of the session, the slides and the recording will be shared with everyone. There are a number of resources that you're more than welcome to reach out for as well and utilise. If you would like to learn anything more about the journeys that both East London, Henry Ford and others have been on with ourselves, and do please get in contact. More than happy to share more with you. And there's a lot more to talk about in this space. So yeah, hopefully we'll see you again, maybe on another webinar too. So if we end it there, have a great weekend, everyone. And we'll see you soon.